Let's talk about the placenta. What it is, where it's located, how does that impact the pregnancy? So first up, what is a placenta? It is a very important organ that grows in the uterus during pregnancy. It acts almost like a lifeline, providing nutrients and oxygen to your baby while getting rid of waste. And it's so important and it's so cool that this is an organ that is created during pregnancy. The placenta normally attaches to the endometrial lining of the uterus, right? And then you have the umbilical cord, which is then attaches to baby, and it helps transmit again the blood from mom to baby, and it takes waste from baby to mom, and mom pees it out and all of those things. Now, there are several locations where the placenta can. So sometimes the placenta would attach to the top part of the uterus, that's called the fundus. It can attach to the front part of the uterus, that's anteriorly. It can attach posteriorly to the back part of the uterus. And these are all normal anatomic locations for the placenta, meaning that it does not change or mean anything that's pathologic, or it does not impact negatively your pregnancy. People will have normal, smooth pregnancies, whether they have a fundal placenta or a posterior or an anterior placenta. An anterior placenta means that the placenta is attached to the front part of the uterus, as seen right here. And for moms who have an anterior placenta, what can tend to happen is the placenta may form and may act similar to like a cushion or in between you and your baby. And so what may tend to happen is you may feel fetal kicks a little less than moms who have placentas that are fundal or posterior, or you may feel fetal kicks a little later in your pregnancy compared to, moms who have posterior or fundal placentas. A low-lying placenta attaches to the lower portion of the uterus, right near the cervix. This can tend to be common, especially earlier on in pregnancy when the placenta and the uterus are just growing. And usually what happens is you will just get monitoring, and hopefully the placenta will move away from being near the cervix. And so again, a low-lying placenta is not always a problem, but if it's too close to the cervix and you're getting really close to the timing of delivery, then it may increase risk of bleeding. And then if it's completely covering the lining of the cervix, that's where we talk about a placenta previa. A placenta previa happens when the placenta is completely covering the cervix, and that's a big deal. A placenta previa means that the placenta is coming before baby's head, and that can cause complications at the time of delivery with respect to bleeding issues, especially at the time of a vaginal delivery, even at the time of a C-section. And so it's going to be very important that if people have a placenta previa, they're following very closely with their physician and follow their doctor's recommendations. Traditionally, if the placenta previa persists, and so if the placenta previa does not resolve itself as we're moving into the third trimester, the recommendations are usually going to be a C-section, because of the increased risk of bleeding, because the placenta is coming before the baby's head, and it is an absolute contraindication to a vaginal delivery. I hope that this is helpful.